Hello, everyone. For those of you I haven't met, my name is Hanny Alsim Carey, and I'm coming from Massachusetts General Hospital in Boston. I'm happy to tell you a bit today about the ASH Medical Educators Institute and my experiences at MEI. So, how many of you enjoy teaching hematology to med students, residents, PAs, NPs, your colleagues, your patients, or just about anyone else? How many of you have already have or would like the idea of integrating medical education into your faculty career in a meaningful way? If you answered yes to either of those questions, you should consider applying for the ASH Medical Educators Institute. MEI is an annual program to guide senior fellows and junior faculty in achieving excellence, leadership, and scholarship in medical education. Now, it's a competitive application, so you apply with a scholarly project proposal in medical education and hematology and convince the MEI review committee that you would make good use of the training in your application. It counts as an ASH award, which is nice, so it goes in your CV in the honors and awards section. If accepted, you join that year's MEI class, which involves attendance at a 4-day workshop at ASH headquarters in Washington, D.C., a series of webinars, and longitudinal mentorship over the year to ensure you have the guidance needed to complete your project. I found the MEI curriculum to be invaluable at teaching me how to be a better educator and, very importantly, to approach medical education in a scholarly way. MEI pairs you up with mentors and colleagues who work with you to tear down your proposal and rebuild it from the ground up as a more refined, more feasible, and more promising project. So when I attended MEI last year, my project was titled Impact of a Modernized Interdisciplinary Hematology Curriculum on Fellow Knowledge, Satisfaction, and Career Choice. As we all know, there is a need for more hematology fellows choosing careers in benign hematology. And my fellowship, though we graduate a whopping 14 HEMOC fellows a year, the rates of fellows choosing to double board in both hematology and oncology had really dwindled in recent years, and the rates of fellows choosing careers in benign hematology had dropped to an average of less than 1 fellow per year. So in order to double board in our program, rather than single boarding in only oncology, which is the default if you don't double board, fellows choose to do a 6-month hematology block in the second year of fellowship. Our second year hematology curriculum had not been updated for many years, and fellows were losing interest. With the support of our program director and as part of a committee of fellows and junior faculty, we redesigned and modernized their curriculum. The challenge of this redesign and the main goal of my MEI project was really understanding how to best evaluate our new curriculum to see if it was accomplishing its stated goals, improving fellow knowledge in hematology, especially benign hematology, as well as increasing the numbers of fellows who double board and who choose careers in benign heme. When I entered ASH-MEI, beyond some Likert scale-based surveys, I didn't really know how to evaluate our changes to the curriculum in a scholarly way. I also didn't know how to approach publishing our results. Throughout the course of the workshop, I learned the quantitative and qualitative methods used in medical education research. Now, this last point, I think, is a really important one. While most of us have some training and experience with quantitative research methods, very few have any experience with qualitative methods, which are really important in medical education. Qualitative methods include doing interviews, recording those interviews, and analyzing respondent answers in a scholarly way that answers a research question, as an example. So with the help of my MEI mentors, I developed a plan for evaluation of our new curriculum looking at realistic and achievable benchmarks, statistical analysis of in-training exam subsections from fellows completing the old versus new curriculum, surveys and interviews of fellows who had completed the old curriculum and the new curriculum, and the number of fellows double boarding and choosing benign hematology as a career. We also developed a 2-stage publication plan to disseminate the results of our work in a meaningful way. So while this project will take 3 to 5 years to finish, given the need for an adequate sample size of fellows participating in the new curriculum, we've already had 12 fellows choose to double board in the first 2 years of the new curriculum, which is more than the 4 prior years combined. So we are optimistic that things are headed in the right direction. So what's the take home here? MEI is a wonderful opportunity for academic hematologists that teaches you how to ask and answer a medical education research question in a rigorous and scholarly way. Thanks, everyone.